starts crying, you know, and you can't let her leave your office with her tears still down her cheeks, you know. And one of my colleagues said, well, very easy to know how you've seen a lot of borderline patients. You have a tendency to go home and drink as much as you can, you know. So, I don't know, let me ask you, what do you like psychiatry for? I mean, why do you like psychiatry?
Just have a little bit of an interest in it. You know, want to learn
How
a
can
little
we
more.
make that little bit of interest a lot of interest? It is a beautiful specialty. I tell you, you could be called for. They called me in the nursing home one time and said, Dr. Caruso, do you do a consult? No, I said I left nursing homes about 4 years ago. Can you do this one consult? Came in there, a 78-year-old woman lying on her side and said, I said, hi, I'm Dr. Caruso. I said, you're a shrink? I don't want to see a shrink. I said, well, maybe I can help you since I drove an hour to come here. She said, well, get out of here, she said. Just a second. So I walked out towards the door and said, by the way, when was your last bowel movement? You know, why did I ask that? Because for older patients, the important thing is their bowel movements. When you start getting older, you'll be concerned with your bowel movements. I bow to you. That's what we talk about in our class reunions. Like we say, the women will be incontinent and the men cannot pee as much as they want because their prostates are getting bigger. Okay, well, anyway, I went down there. When I went back, I was surprised when I said, when was your last bowel movement? Thank God, she said, somebody finally asked. So I was surprised. And I said, well, no, really, when was your last bowel movement? Thank God, she said. I have been complaining of that for 4 days. Really? I said, okay, maybe I could help you a little bit. Let me talk to the nurses. And I said, give me a pair of gloves, you know. And I did a rectal exam, and she had her rectal vault full of pieces. I said, well, let me go take the nurse to do some fecal extraction. Oh no, since your hand is there, make sure you be the one to do it, she said. Oh, I go, okay. So I did the fecal extraction, which I never did since my clerkship years. You know, I tell you that you're expected to do as much as you can, even as a psychiatrist. So then I led her to the bathroom to sort of like take a shower and clean herself up. And then I went out and I go, sure, I did the patient a favor, but how do you bill that when you bill? How do you put the code for fecal extraction and you're a psychiatrist, you know? But they did it anyway. So I'm just telling you some things that you may see. We get fields like occupational psychiatry, which means you're a psychiatrist evaluating people in the workplace. In a big company where there's a lot of conflicts, you are then sent to make some psychiatric evaluation, and most of these are all related to personality traits and personality disorders, you know. So you're going to figure out for a company what works best for them, like who people can work together, or you can be therapeutic, making two people angry with one another, complete a project so that they could learn to work together despite their differences. Then you have one very important and very interesting thing, forensic psychiatry. And mostly our training was done in Elgin forensic psychiatry, where you see all these people who are judged not guilty by reason of insanity. My favorite story about this is how I went there when I was in third year, and I was assigned to the final unit, which was Dr. Meissner's unit. And Dr. Meissner, I went there at 5 o'clock in the morning to read all the charts that were signed out to me by the resident ahead of me. There were 12 patients. So I was ready for my mentor, and I go, Dr. Meissner, you're wrong. I saw all the patients already, chatted with them a little bit. I'm done with my progress notes. So what do we do? Oh no, you shouldn't do those. He said, I'm assigning you one patient, and don't pay attention to it. No, that's not fair. I already did the 12, I said. Well, he said, well, I'm assigning you this one patient. Now, what's the catch to that? He said, well, this patient has been here for 9 months, and we do not have a history on him. Oh, that's not fair. I said, there were 6 residents ahead of me on a 3-month, and they should have been able to do it. No, Emma, this time you're going to just do it. So I approached this man and I said, "Excuse me, Mr. J. I'm Dr. Russo. I'm the resident in charge of the book." "Oh, okay. If you don't want to talk to me," I said, "that's my office assigned to me there. Just go in there anytime." He didn't show up until lunchtime. So I saw him in the dining room and I put my tray in front of him across the table and I said to him, "Mr. J, we really need to continue with this." I was a little bit intimidated, afraid, a little bit upset. Oh, why can't I get through this man, you know? I said, "Well, okay," after eating, Meissner calls me and says, "God damn it, Emma, you haven't done this and we really need this, you know." I'm sorry, is anybody offended by it? Okay. So I said, "Well, I'm trying, sir. You know, I'm supposed to go home at 3:30. Okay, I'll go home at 5, you know. Okay, I'll go home at 10. I'll try, okay." I said, "If I'm not able to do this, then tough, you know. I can't do it. I can't do it." I said, "I'm going to stay till 10, right? Just do it." He said, "Do you know what will happen to this man if you don't get this history?" "Well, what?" I go, "He goes to Chester." You know what Chester is? Chester is a psychiatric facility, which is also a prison for the most severe sociopaths. And when you get assigned there, you're supposed to wear a raincoat. Doesn't matter how hot it is. Wear boots and bring 2 umbrellas. You know why? Anybody can venture a guess on why you do this? Well, you have to walk through between the prison cells, you know, and they pick up your feces and they throw it at you, okay? That doesn't happen oftentimes in the residency training. Don't worry. So I said, "Just do it. We don't want this man to go there. He's only 59, and he's really not guilty by reason of insanity. I've been observing him. He doesn't talk. He doesn't do anything, but we heard him whispering, so he has a voice. He's not muted. He is catatonic at times, but, you know, just try to get a history. And for forensic, history is much longer than you think it is." So he said, 3:30, I approached this man. I'm sorry, okay? I approached this man and I said, "Mr. J, we really, really have to do this, or you get assigned to Chester. You know what that is? It's a very bad place, and we don't want to put you there." He goes to me and he said, "F you, you know." And I got so frightened. He came this goes, "F you." He said, "Well," I said, "Well, F you too. I really need to do this." And he goes, "Yes, ma'am." And he goes, you know, and as I was sitting there, this was the table, and he was seated right here. I said, "Oh, what did you really do?" Takes a picture out from his pocket, shows me this picture that was an almost decapitated baby. "You see this?" He goes, "This is my mother," he said. And they told me I stabbed her 117 times in the neck. Oh. And I put my hands in all the alarm under the table and hid all the alarm until about 6 security guards came. "Are you scared of me?" He said, "Yeah." I said, "You know, I think there's an art about psychiatry. Like if I'm too threatened with a patient, I sit down and I look down. Like one of my schizophrenic patients, I said, 'Oh my God, kid, don't do this to me. Don't yell like that. I'm scared. You're scaring me. You scare me, I can't help you. And just sit down across me,' you know." So you have to, it's almost like you've got to have that feeling, a gut feeling. There's some patients, "Don't do this, don't yell like that. I can't think when you do this. I can't treat you. Sit down." And there are some patients, like I have this very intelligent bipolar guy who was completely manic. 6 Naperville police jumped on him, and I was there. I said, don't hurt him. It's really like, "Hey, Brian, get up, sit down here." And one of the police officers got scared and tasered him. Boy, was I angry with this policeman. I said, "I didn't tell you to taser my patient." He was going to listen to me. Somehow, no matter how psychotic they are, there's this little part of them that really connects with you if they have been your patient for a long time. With Brian, no matter how psychotic he is, I would say, "Brian, you're psychotic again. Sit down. Let's fix your psychosis so you can write your book." "Oh, okay," he says. You know, so there's a certain, if they know you care for them, like